So now we will officially get started. My name is Mary Biddle-Koenig. I'm the Assistant Director of the Smith Enterprise Risk Consortium, or SERC as we call it, at the Robert H. Smith School of Business at the University of Maryland. I would like to welcome you to the first webinar of 2024 and our monthly Risk Leadership Series, which is brought to you by SERC, ZRG Partners, and the Office of Executive Education at the Smith School. As many of you already know, our webinars are focused on top-of-mind topics that vary from month to month. Last month, we had a great discussion about the climate negotiations at COP28. And next month, we'll talk with Janice Inglesby from Arch Capital about the challenges of ensuring cyber risks. But today, we are kicking off our 2024 series with a discussion that is at the heart of what SERC is all about. The fact that risks span industries, and the lessons in one can definitely be applied in another. To kick us off, I would like to introduce Rob Iamazzo. Rob is Managing Director of ZRG Partners and currently leads ZRG's Global Enterprise Risk and Analytics practice. We've partnered with Rob for many years to bring you the Risk Leadership Series, and I'm pleased to turn it over to him to kick us off today.
Thank you, Mary Biddle. And it really is a pleasure to be here as it is on a monthly basis. And this in particular is as Diane had the pleasure of getting to know years ago while she had a career in financial services and now parlayed that into the pharmaceutical space. So it's exciting as the pharma sector is embracing and identifying enterprise risk professionals and operational risk professionals from what we're seeing. And who better than Diane Doring at Takata and, of course, Cliff Rossi. We're grateful for our continued collaboration and partnership with the Smith Enterprise Risk Consortium, and wanted to just wish you a great discussion, which I'm sure it will be. And I know that in several conversations I've had over the past week, people were just curious and interested to see how Diane, who has a career in banking and financial services, has successfully parlayed into this space. And Cliff, as we all know, being a forefront leader in supply chain risk management in the pharma space, one area there, and how all this comes to fruition. So with that, I'll turn it over to you, Cliff and Diane. Thank you.
Yeah, thank you, Rob. I appreciate everything you've been doing to support us here in SERC. And Diane, it's an absolute pleasure, as Rob said before, to have you here with us today on this topic. And just to add a little bit to what you were saying there, you know, when I think about your career, and we're going to dive into that a little bit more detail here, it says a lot about sort of where we are in the risk management, kind of like maturity, if you will. Right, there's sectors you started off or you were involved with banking for some time around enterprise risk management, and other sectors have started to build these areas. In some cases, they resemble more of a standard type of ERM function. In other sectors, that is, they're more piecemeal and take more of an incremental approach. But nonetheless, when you kind of step back away from it, a lot of the concepts and enablers of ERM are applicable basically, as we're finding, to any business, whether it's a bank or a pharmaceutical company or a government agency for that matter. We're seeing many cases where there are these CROs that have been set up and risk organizations within federal agencies. So understanding how that manifests, right, it has to start somewhere. The challenges, you know, that we face from one sector to another, they're very different. The risks in many cases are, while there are a lot of similarities, there's still a lot of differences in the emphasis on these risks, as well as how, you know, ERM can be useful to risk managers looking to get a fresh perspective from one sector to another. And the last thing I'll say is when we were starting SERC, or actually when we had the idea behind SERC and we started to socialize it with various risk executives from different industries, you know, everything from aerospace to banking and insurance and reinsurance and pharmaceutical, etc. The one thing that came out was, wow, this is great, because, you know, in our space, we don't spend a lot of time engaging with our peers from other sectors to learn how they're, let's say, managing operational risk, which is something that is common to everybody, right? So kind of from that standpoint, I think it makes a lot of sense to kind of have this conversation. So I think one of the first thof we'd like to hear about, Diane, kind of to kick this off for the audience here, is with your far-ranging career in financial services, I'd like to I'm just curious as to what attracted you to take a role in pharma and risk management. How did that come to pass, and what made you interested?
Sure. Thanks for that question. And I just wanted to start by saying thank you for having me today. I'm really excited about our conversation, and I couldn't agree more with the things that you led with. I would say that I was actually more attracted to the culture of the organization. I didn't really set out to be moving from financial services or into operations in my previous role or into pharma. I was just really excited to be continuing to learn and to leverage my experience, but also be part of a larger organization that has a mission of making lives better and better health, brighter future is a Takeda tagline that resonated with me, and the culture has been a wonderful culture since I joined. So I couldn't be happier in my new role. I still have a lot to learn, so I'm glad to have this conversation. But Cliff, I think you have even more experience in the pharma world than I do, so I'm really glad for this discussion.
Yeah, I like to think that I kind of accidentally backed into some of that, but yeah, let me flip that around. Why do you think Takeda was look beyond pharma to select somebody like yourself from another sector to come in and head enterprise risk management for them? What do you think it was that sort of sparked their interest?
Sure. Well, at first, I think it's availability, right? I think the first choice would have been someone who has pharma experience and ERM experience. But as we were saying earlier, ERM is a growing discipline within pharma. It's not as mature as it is in financial services for the reasons that, with the regulatory environment and all the requirements for the banks to have a really robust framework in place. So I think besides availability, it's also, I always say when you're new, you get to ask all the dumb questions. I know people say there are no dumb questions, but yeah, there sometimes are. But being new to the industry, I think it's good to be curious and be able to challenge the status quo, regardless of where you are. And so being new to an organization or new to a sector, you get to be that person to ask the questions that no one else in the room gets to ask.
Interesting. Yeah, no, that's true. When you are the new person, that you do get a little bit of a pass, for a period of time to kind of come up to speed on that. So tell us a little bit about how you're approaching and how Takeda is approaching, just generally speaking, ERM, at the company. I mean, does it resemble what we think of from a standard sort of banking model, or is it something altogether different, or how's that look?
Sure. Well, I think they've taken a wonderful approach, actually. It's a small team, but we have a risk coordinator community that we leverage. So instead of building out a huge function, it's really streamlined, and we want to make sure that we provide that framework and interaction with our risk coordinators, the folks, our network around the globe, different parts of the business, to really provide them with what they need to think about risks locally, but then also how do they escalate risks to us so that we can raise that at the executive level and our global risk committee.
Is this a new function? I mean, did it come in with you, or was this something that has been around for some time?
Yeah, only a few years. It was established before I joined, and I'm glad to be able to continue to evolve it with a very strong foundation. It's really trying to embed risk into the culture, and by having people think about it, not necessarily as a formality yet, but as an exercise to bring risk to the table. So yeah, it's still, I think there's a lot of opportunity to continue to evolve it to make it work for the organization. But I was really impressed with the strong foundation that was built to gather that information, and also the support from leadership to really build out this function and to continue to grow it, and give it more teeth. I think sometimes, and I'm not talking for my current employer, but sometimes people see ERM or risk as a check the box, like, okay, we have to have this, the board wants it, the regulators want it, but what is it going to do for me other than I have to? And so just trying to continue those conversations to show the relevance, to show that it can be a strategic advantage to be proactively having these strategic discussions around risk.
Yeah, that one resonates. That experience resonates with me big time in the sense that um, you're fortunate. I think that you have leadership that first and foremost recognizes off the bat the importance of risk management. Sometimes, as you said at the outset here, it's particularly those of us on the banking side have kind of felt it, right, seen it up close. That it's more of a check the box. We've got to do this because the regulators say we have to do it for whatever reason. That's refreshing, and is this, to me anyway, is the sign of a very healthy risk culture, right, where that organization has really good risk DNA from the top down, and that will help that function thrive over time. Because, and I'm curious to, I've interacted with different pharma companies over the last several years here, and right there, and it's a different ballgame than what you see in the banking sector. I keep coming back to banking only because of the nature of regulation there, and there's regulation over with the FDA, of course, and whatnot in pharma. But I keep coming back to that because when I think about a pharma company, I'm also reminded back from my banking days that people would say, well, if you have a bad day in banking, it's not like you're going to lose a patient. Whereas in pharma, you could very well have problems, right, with patients downstream and whatever drug products you're creating and what have you, drug supply chain shortages and whatnot. So I guess I come back and say, do you see that by the very nature of that business model being have a much greater focus, right, on quality risk management, particularly in the supply chain, the manufacturing, the clinical trials, and everything through that process, is something that may, at least from Takeda's standpoint, is maybe a catalyst for promoting good risk management practices that they want they have something in that culture that drives them to do that? What do you think?
Yes, absolutely. I think it's really embedded in their culture, and there's a lens that we use to action our values, the acronym is PTRB, Patient, Trust, Reputation, Business, in that order. And so that's even the lens that we use from a risk management perspective. So that emanates all throughout the organization. I didn't see that in financial services. It's more like, how much money are we going to lose, or what's it going to cost, or do we have access to people, or a reputation, legal, regulatory? So even embedding our decision-making process in the risk evaluation process, I think, is a great alignment and really supporting the culture of considering risks and knowing that we have different stakeholders, right? So I think it's a great learning lesson and a way to continue to evolve and make it real and personable rather than just risk management.
Yeah, I'm curious to, and there's a lot of, right, there's a lot of scientists that, right, are part of your employee base there too. So what I found there too is that they're very analytical in nature, and again, the nature of the business being what it is. I would almost, I don't want to generalize this, but it certainly seems in my sort of interactions that folks over there are generally more risk averse to begin with, just by nature of the product set that you have. Which is, if that's true, that certainly probably again goes to the conversation that we just had, that companies are more like that. But one of the things that and Rob mentioned this at the outset here too, is that we don't see as much if you look at the maturity cycle of enterprise risk management in banking overall versus what we see in pharmaceutical. Yeah, there are companies, particularly some of the bigger companies, that might have a CRO, or they'll have somebody that's called the head of quality, right? And there seems to be these pockets than more of what we see in your situation. I'm just wondering why that is. It just hasn't yet kind of gelled in the industry yet to see that ERM is something that holistically is a unifying force within a company.
Yeah, I agree with what you're saying. I don't know that I have that macro view looking across, but from where I sit, I think the model continues to evolve, right? ERM is still something that people are learning about, but differently. We don't have a chief risk officer. We don't have a risk group per se. I'm part of our ethics and compliance. group, which someone had said to me when I was joining, that's a perfect place to be, right? Because that's the strong focus in the risk averse world of pharma. So embedding with risk ethics and compliance is a great place to start and be. When you talk about the fragmentation, I think it's because different parts of the business are also at different maturity levels, and because there's different parts of our product life cycle, there's maturity that's required for FDA approvals and trials and manufacturing. And so we don't want to duplicate what's already been built and is very mature. So when I'm trying to navigate and learn is how do we complement each other and make sure that we're not stepping on each other's toes, but duplicating efforts.
Yeah, a lot of it is about communication. I can imagine that you've had it for several years, but even so, there's always, and you probably felt this on the financial services side, felt that there's trying to, the first time that ERM really is kind of integrated or brought into an organization, there's a whole mindset that you have to, as they say, you have to kind of win the hearts and minds of the business, the first line of defense, if you will, who otherwise could come across saying that, we've got too many checkers checking the checkers and all those things that we sometimes hear. It sounds like maybe it's been a fairly welcoming environment from the business side in your case. And was that set by the tone from on high in your organization that, hey, we are all about risk management? How does that work there?
Yeah, I definitely think it is toned from the top, as that phrase that we've often used. But I also think that it's continuing to grow. And as we think about giving ERM more teeth, what does that look like? What is the role of ERM? And I wouldn't necessarily say that this is for pharma or my organization, but I think enterprise risk needs to continue to evolve because there's so many different risk assessments out there. We have to be able to differentiate ourselves from the others and show the value and the strategic nature of it. And the way I look at that is that ERM provides that backdrop for thinking about these other risk assessments, whether it's a privacy impact analysis, a business impact analysis, the compliance risk assessment. There's all these different risk assessments that are coming up. So how do we continue to think about ERM as an integrated risk management framework, bringing these pieces together to tell the story, to be actionable, timely, relevant, and those things. So I think ERM needs to continue to evolve for all industries, not just in pharma or within Takeda.
Interesting. So I want to dig into this a little bit more in terms of some of the basically, maybe we start off with this. What are some of the similarities that you saw, from your financial services days that are there in your pharma days now? I mean, what sort of things? You've talked about risk assessments, so I presume risk control self-assessments are, part and parcel. I would imagine that there's probably even a heavier emphasis more on the ops side than there is maybe in the financial services. But you tell me, what do you see?
Sure. Yes, it's definitely, there's a formal program for assessing risks on an annual basis and bringing that up, which is similar to, our annual heat map, looking at the top risks. How do you think about the top risks that we see in general, and how does that impact the organization? Evolving our heat map. I think, we all start with the two-dimensional heat map. We've talked about this a little bit in prior discussions. Impact and likelihood is still, it works, but it's still continuing to evolve. We wanted to be able to overlay management capabilities or control effectiveness into that. And so the similarities of growing that discussion, I think, have resonated. But beyond that, I think it's still too early for me to tell really how many, other than it's a framework that's been required and we need to continue to strengthen it, which is when I started in financial services, it was a similar thing. It didn't really exist. We were building it and strengthening it and it was piecemeal back then too in financial services, operational risk, credit risk, market risk, thinking about all these different pieces, and then bringing that all together That was fragmented back then as well, but bringing it together under a chief risk officer was that part of the evolution. So those are the similarities, I would say, is that, it's fragmented, it has to come together. And it depends on the organization, how you do that.
Yeah. So when I think of ERM components and frameworks and whatnot, things that kind of naturally come to mind are things like risk appetite statements, risk taxonomies, 3 lines of defense, right? And then risk committees, board management. Do you have that sort of setup, or is that sort of in play at this point at Takeda?
Yeah, thanks for that question too, because yes, governance is important as well. And so making sure that the board has oversight, and then we have senior level at our executive team level, global risk and ethics and compliance committee, just that governance and building or strengthening the pipeline to bring the message from the bottom up and the top down. Yeah.
Good.
I think, yeah, I think culture too is important there to have those conversations. So you're building the pipes, but then you're also building the discussion and facilitating. So it becomes the challenge of making it relevant in that way for both sides. So in those similarities and looking at the different pieces, risk appetite itself. I think what I've also tried to do is be careful of using a lot of risk jargon. I think people get nervous when you say we have to write a risk appetite statement or what's your risk tolerance. And if you know from the values of your organization and sharing our decision-making model, you can tell that you're relatively risk averse. But where are those lines, and how do you operationalize risk appetite, I think becomes a challenge in any organization, and something that I look forward to having those conversations in the future.
That point you made about not trying to, bombard the business units and teams with too much risk jargon is really kind of insightful, I think, because I think all too often, and mea culpa on occasions back in the past, I think you can easily kind of slide into that. Where then the business teams are like, hey, what are these second line units really trying to do to us, right? And so trying to be that trusted advisor, right, but being balanced about it is kind of what's critical. And I think it's great again that you have this cultural advantage, I'll call it, within your company that at least recognizes that. There's another dimension here to think about than just the pure business side of things. That we've got to manage these risks as we go along. And I guess I hate to go back into the jargon for a second, but again, I think it's just simply because most of the large banks are familiar with these terms. But 3 lines of defense, we've seen it. We have it for the largest institutions here, and by and large, we have it down all the way to even some of the smaller institutions, certainly the regional banks and whatnot. But I'm guessing that that's still not in place to that specific degree at a pharmaceutical company, right? You can have ERM functions, but you don't think of them in these kind of like 3 lines of defense mode. Is that safe to say? That's a fair characterization?
Yes. Again, because I think we're kind of set up that way without calling it 3 lines of defense. I think that becomes jargon, like some of the other words around residual risk and velocity of risk and things like that. But I think naturally most organizations are set up that the business is managing and understanding their risks. And if you have an audit department and working with audit, and now with the risk function, we do have to collaborate and partner to make sure that we are managing those risks effectively. So without getting technical and calling it that, we're going to implement the 3 lines of defense or the 3 lines, whatever we're calling it these days. I think by nature of how we're set up, we do that without using those terms.
Right. Is it in your role, have you been charged with overseeing? You mentioned compliance and ethics and some of those things, but operational risk, is all of that under your umbrella, your purview, basically?
Yes, we have an operational or business resilience policy, which includes ERM and business continuity and crisis management. I'm not involved in crisis management. I leave that to my very well qualified colleagues, but I see business continuity supporting ERM and also helping be prepared for the crisis when it happens. So having those all together, I think make it strong. So yes, BCM and ERM are kind of under my purview, collaborating with other parts of the organization to bring that to life.
And to kind of dig into that a little bit more too. So the organizations, the business organization, again, you're a small team within a large company, multiple business areas, functions, and whatnot. They're on the hook for performing annual risk assessments in their areas. You want them accountable, like we were saying before. We might not call first line defense, but you want that first line point accountable for those kinds of things. Then they back over to you.
We just, Cliff, you're on mute. We've lost the microphone.
He's trying to bring that back.
Sorry about that. Can
There
you hear me now?
Yes,
Okay,
we can
sorry
hear you
about
now.
that. I can't use my hands because if I do that, I'll hit my microphone, and that's a bad thing. So I won't get excited like that anymore. But risk management, right, it's very exciting. One of the things I guess I come back to is that these business units, you know, they're providing you with these risk assessment results. Then you take them, and are you providing like and again, I hate to use the jargon here, but credible challenge to the business units? How does that play into this, or is that something that's kind of a softer touch?
So I wouldn't use that word. I've used it in the past when working with folks in cybersecurity, right? ERM was credible challenge per se on that level. I think at the moment, as we consider our risks at the local level and then what gets escalated to be some of the top risks, thinking about how do we prioritize those? And so providing that challenge, what is and how do we prioritize those based on the risk itself, but our mitigation strategies? And then are they sufficient? So, you know, when we were talking about the similarities in the tools, and I was mentioning the heat map, trying to continue to evolve that heat map to be multidimensional, so that even taking it from inherent risk to residual risk, you know, not to use the jargon, but, you know, impact times likelihood, less the management effectiveness to get your residual risk. Okay, so what? What does that mean later? And a lot of these top risks that we see move around on the heat map. I had someone say to me a long time ago, I wish we had animated our heat map because things move up and down and all around. And I'm like, well, that means we're doing it right. Because what you need, the heat map is supposed to do is help us focus on the top risks, right? And so when you think about prioritizing those, are they prioritized based on the risk itself, or how comfortable you are with the mitigation, and whether or not there needs to be more done to address that? And so that's the challenge that we're bringing back, is that, yep, we understand this might be a risk. Some people might be comfortable with the way we operate, and we can tolerate that risk. But then where are those risks that we aren't necessarily as comfortable, and we need to make some improvements? That's the challenge in the way that we're trying to push back and make the business think more holistically about it, and then providing additional oversight from a governance perspective at the higher level, at the risk committee.
I see. On that one, you mentioned risk tolerance. I'm guessing somewhere in your framework you have some sort of a process by which you are assessing and figuring out what your risk tolerance might be for a particular risk type. Is that the case? And that kind of is an let's say a interactive discussion among the business teams and the risk teams?
Yep. Again, not trying to use jargon or sidestep this, but without using those words, those are part of the discussions, right? Are we tolerating this risk, or do we need to do more to address it? And then how do we make sure that there's this, that everyone's on board, right? That when it's cross-functional, there's these interdependencies, that everyone is seeing that risk from the same lens.
So I'm guessing, based on the fact that you are appropriately pushing back on my use of jargon, does the word KRI ever enter the lexicon, or is that something that you just like, we don't want to even talk about KRIs, but I'm guessing there may be KPIs, over on the business side, right? So
Yeah,
do you have
KPIs for sure. And I think, KRIs from a risk perspective, I think unfortunately our success is backward looking. KRIs don't necessarily tell you you're about to have an issue. So right now I haven't been pushing KRIs, but KPIs for sure exist, and trying to pull together the right KPIs to tell the message of where risks might be increasing or decreasing is really important. But yeah, I try to stay away from trying to predict the future. But when we think about looking back, and we think about the risk in context of the external environment, the internal environment, what do we need to do differently? And having those conversations for pre-planning and preparing, you don't necessarily know that you're addressing a future risk yet until you look back and say, oh, thank goodness we had done that. I think one of the examples of that is, we obviously have lived through the global pandemic, and business continuity was read across the globe, across all businesses, and having those conversations around what changes, right? What other risks do we have to now pay more attention to given the environment, such as fraud, workplace violence, due to the stress and things like that. And it wasn't until later that when I look back, those conversations were really fruitful at the time, because we were able to put steps in place to look for that kind of behavior, get people prepared, and address those proactively rather than being surprised by it later.
Interesting. Yeah, that's always a big one for us, right? Is to look back as opposed to the look forward, and how do we sort of make that connection back, and what it informs us for, maybe the playbook going forward to, as you said, being able to start to detect when emerging things are happening before they actually take place. That's interesting. Do any of these get let me see if I can say this correctly, have risk metrics, however you want to define those, started to find their way into, let's say, incentive compensation or performance evaluations, or is that again probably too new at this point?
I would say I'm too new to really give you a solid answer on that one.
Yeah, no, and again, that's, we see that certainly from the 2008 crisis period, that there has been more emphasis in the financial services side to kind of push, trying to get more of those, metrics into incentive compensation plans than we'd seen in the past. But again, a lot of this is an evolution, as you well know. Rome wasn't built in a day, so we kind of move these things along in a methodical way. It just occurred to me, when we think about the various risks that a company like Takeda faces, right? All sorts of flavors of operational risk and compliance, regulatory risk, right? All sorts of things. Some of the things that we've been thinking about at SERC are around these non-traditional risks, and how we were describing those is, right, we've got one bucket over here is all the financial risks that certainly are more sort of oriented toward the banking sector, right? Asset liability management, the market risk, interest rate risk, credit risk, et cetera, liquidity. Then the non-financial risks that I think we're really kind of talking about here, and then including supply chain risk. And then finally, non-traditional risks that really kind of come down to like climate, AI, machine learning type risk, cyber risk. How does Takeda, I should say, just overall, how does that kind of fit in? Is that something that you have folks that are focused on those in particular, or that they, as they come up, as you said before, your risk may change over time. How are you thinking about weaving them into sort of your risk taxonomy? Again, my bad for the jargon.
Sure. No, those are definitely top risks for, excuse me, any organization, and that we're definitely thinking about it in a proactive way. So collaborating with my colleagues in sustainability, thinking about climate, aligning risk, enterprise risk with, excuse me, the double materiality assessment, and other risk frameworks there. Again, coming back to that integrated risk management, how do we continue to evolve to support multiple assessments? I think when it comes to AI and machine learning, there's a lot of opportunity there and for innovation, and how to let innovation in to an organization while protecting privacy and data and all that. I think that's an important play. And there's definitely teams that are now coming together to collaborate across functions to do that, because we know we need to innovate. We know AI is going to be in our future. It's here now. But how do we do so in a manner that continues to maintain trust with our patients, with the outside world, our stakeholders? So balancing that innovation, AI innovation, and business with trust. So we're definitely thinking a lot about that. When it comes to cyber as well, that also, I'm actually thinking about cyber a little differently now as well. Like, to me, originally, it's more about the infrastructure and how are you protecting your organization from the pipes and the applications and firewalls and things like that. But then also, how do you use that to accelerate and support AI from a technology perspective? Where do those boundaries start to blur? So continuing to evolve and learn from my colleagues around that. But the short answer to your question is yes, we're thinking about these non-traditional risks. I think if organizations aren't, they should be, because they're out there, and we need to pay attention to them. They're not going away. But I am very excited that even from where I sit, I get to interact with folks in different parts of the organization that are focused on these different areas of non-traditional risk.
It's one of the things I tell my students these days, that why I like risk management as a career, even though it was clearly very stressful at my time, as it was, I'm sure, at various times for yourself, was that being in risk management, you get to see pretty much everything that goes on that matters at the company, right? Whether it's technical, non-technical, financial, non-financial, you're in the thick of it. So there is that dimension of it that makes it very, very interesting. One of the things that I'm very kind of curious about hearing is, and I think also from some of our audiences, what do you think the most important technical, say, non-technical skills a risk manager needs to be able to kind of make that transition between industries, right? Because I can't imagine that somebody is the market risk officer of such and such a company is automatically going to make such a seamless transition over to Takeda Pharmaceuticals. I mean, you seem to have that right blend of technical, non-technical skills that allows you to come in there, and even though you're new in the game on this particular role, it allows you, that to have that sort of overarching broad understanding of what's going on from a risk standpoint, regardless of what industry you're in. You got to get the domain. I'm sure you'll get all that, that the pharmaceutical stuff as it comes in. But what do you think, are those skills that are important to make such a transition? If we're thinking about maybe one day that you do get to see more people kind of moving from one sector to another because of this blend of skills.
Yeah, that's a really great question. I think I should also start by saying I have a non-traditional journey into risk management. So no formal training. I'm not a quantitative analyst. I come from pragmatic. I come at it from a pragmatic standpoint, common sense. Should we be doing the things that we're doing? So from a technical perspective, I think you definitely need to know the different tools in the ERM framework, and how you can leverage those in any organization. Process mapping, understanding process, and being able to understand the business, I think is still technical. Being able to draw process maps, I go back to them over and over again because clear is kind, to paraphrase Brene Brown. But when you are looking at roles and responsibilities and connectivity and connection points, I think from an operational risk perspective, way back when in financial services, being able to first describe the process and then show where the handoffs are and the control activity became very helpful in getting everyone around the table to see where the potential gaps were. And so I carry that with me in everything I do, thinking about the process, thinking about policy, understanding the difference between policy, process, guidelines, etc. And then understanding what the regulators are looking for as well. You can't just decide to build a risk program that you want to build. It has to satisfy many stakeholders. So having the awareness around the basic components that are going to be looked at in the future. I think on the non-technical side, there's a lot more on that side, right? I think you have to be able to listen to hear and translate. You have to have courage to speak up. I think that's, we were talking about asking the dumb questions, but there's times when you have to push back or challenge folks that are probably more expert than you. And I think back early days when I was in risk management, operational risk, I was talking to someone on the trading side and asking probing questions and trying to push the conversation a little bit, and was pretty much told in no uncertain terms to leave the office. So I went and I told my boss that, and I said, "Oh, you might be getting a call. I'm sure I've upset him and made him mad." And he goes, "Well, did he throw the phone at you?" And I'm like, "No." And he goes, "Well, you got off easy then, right?" So of course, no one was hurt. It wasn't verbally abusive. It was a different time. But being able to stand your ground and make those conversations productive at the right time, I think is really important. And then being able to translate some things. Sometimes things are complex too, and into the simple, translating complex to simple, and that comes also too with that courage to be able to challenge the experts, right? Like we were talking about modeling just before we joined, and so how can you challenge the models and the assumptions if you're not expert in modeling, but you still want to make sure that you're protecting and asking the probing questions. So being able to speak up and be heard without being necessarily in their face and shutting things down, because we know that risk management is, there's always that debate on what our role is. Are we the police? Are we advisors? Do we automatically shut things down? And I always try to look at us as the enabler for the business to keep them out of trouble while supporting their objectives. So trying to walk that fine line and being less bureaucratic. So don't let perfection get in the way of progress. Being able to see that, okay, maybe I don't have all the things that I want at the moment, but am I making progress and having those conversations and seeing risk discussions evolve? And, when you look back, again, it's backward looking a little bit when people start using risk terms or asking themselves risk type questions, then you've probably had an impact there.
Yeah, no, that's a lesson for everybody in risk management and wherever you're at, right? Is that just that interpersonal dynamic. I think at times risk managers, the ones that are in the second line, will say, face a tough time because the business may not always appreciate what they're bringing to the table, and trying to kind of bring out to them that there's an important aspect to that. Couple things that I wanted to, I'm keeping an eye on time. I've got some questions coming in from the audience, so this is great. I should have actually said that up front, that if you anybody that's out there listening that would like to kind of put questions into a Q&A, we'll try to get through as many of these as possible. One that's come through is, what are the risks that are most prevalent today for an enterprise like Takeda, which are kind of like the top ones that you're always kind of thinking of?
I would say those risks aren't necessarily just for Takeda, but I think when we look out the window, as we used to call it, geopolitical risk and that impact on supply chain, just the conflicts that are happening everywhere, extreme climate, and how do all of these, when you look at all the risk reports that have recently been released, one of the themes I hear is, uncertainty is going to continue, right? And multiple crises at the same time. And so is that in the context of that world that we're living in, how does that impact people, both patients and as well as employees? We don't live in a bubble necessarily. And so when we see these conflicts on television, it impacts us. When we have to deal with storms, we've just had a series of 3 storms here in Maine, and the coast has been hit very hard in rapid succession in a short amount of time. So people dealing with extreme climate in real life, what does that do to them, and how does that impact folks in the workplace, and how do we need to then continue to guide behavior given all these risks out there? So just trying to think through all of these macro risks and the potential implications internally is where we're trying to steer some of the conversations strategically.
Yeah, there's a couple things that you were just saying there that I'm reminded of. I mean, back in July, right? Pfizer had that warehouse facility that was taken out by, I forget what magnitude tornado it was in North Carolina, and the impact on supply chains, right? You sometimes take it for granted that, hey, here we are sitting in North Carolina, we're fairly well protected. That's something that happens in areas like Oklahoma, right? But yet, and we actually did an analysis of this recently, and the 6,000 registered farmer facilities in the United States, more than a third are exposed to significant amount of tornado risk. And just understanding those things, just having an organization like a risk management function that's going in and providing that to your manufacturing folks can be enormously valuable, just kind of from a basic risk management or identification of risk standpoint. So those are kind of important. The other thing that strikes me about that is again, I was working with the FDA on a research project a couple of years ago on leveraging advanced manufacturing technologies like continuous manufacturing to bring drug manufacturing back to the United States because of all the drug supply chain issues and continuity and quality issues and things like that. And there is this integration point between the finance units, the folks that are there that have to figure out is it the benefit cost analysis of whether or not we stay with our old batch processing or go with this new CM technology. Where what I've been finding is that the engineers that have the technology down, they've got all the data and everything where they can say, look, we can point to all the efficiencies and lower costs that you're going to get by doing this, and better quality as a result. But it's hard to have the conversation with then the finance teams, the controllers and all those that haven't seen this before. And risk managers live in this world of more probabilistic outcomes, right? There's a whole range of scenarios as we've been talking about here, and trying to go back to the business units to kind of say, we have a way for you to think about this that's perhaps different from what you've seen in the past, but yet it's value added. Those conversations, I think, are very meaningful and will be more impactful to ERM units in sectors like pharma that are maybe more starting off on their journeys than other areas like financial services have been. But that's just more of a comment or an observation or an experience than anything else, I'd say.
Yeah. And Cliff, I agree with you there. And I think the challenge for ERM is to make that facilitate those discussions at the business level, right? Not that we need to be in them, but just providing the context and the framework to allow the flow of conversations to go up and down, and not be the middleman necessarily, but to really support those that are in the business to have those conversations. I think that's a really good way to leverage and be strategic.
Yeah, I do think that that facilitation role it shouldn't be, underplayed in any sense, because I think that can be, you say, well, what does that get for you? In an organization that may not be, that has been thinking on a linear basis on certain ways of doing business, you have a risk team that's maybe exploring kind of on a broader basis, looking across business units, maybe across other areas, and saying, hey, have you tried thinking about it this way? Again, is good risk management, I think, and just trying to basically help them understand that there are other ways of thinking through these problems that maybe they haven't explored before, but also have a risk management dimension to them. I think that's important. I'm looking at a couple of I'm looking at the clock, and I'm also looking at the questions that have come in. Some of these I think are maybe broader in scope, but I'm gonna see what your thoughts are. Contrast financial / operational risk management and public sector / private sector risk management. That's interesting. There's a lot on there.
Yeah. So not being in the private sector, I'm not sure I could speak to that completely, but I would think that it's similar in both, right? That you need to have a framework. You need to be assessing risks, both from, macro, looking out the window, and operational and strategic. So I wish I had a better answer. Maybe Cliff, you do on that one, but private, public, I think the frameworks work regardless of sector, right? And that's why we're talking, right? We're talking about ERM in financial services and in pharma and in public. So
absolutely. The number of years ago, OMB issued a circular that required federal agencies to set up risk management capabilities, and many of these today, like U.S. Treasury and others, actually have a chief risk officer. And the things that we've been talking about here on this webinar, again, more jargon than not, but this notion of a risk appetite statement and a risk taxonomy, and committee structure and governance, and tolerances and KRIs, and all those things are spec'd out in the playbook for ERM that federal agencies have, and we see this in other organizations as well. So the only thing I'd say about it, from what I've seen, is that in the federal agency space, depending on the agency, again, you see a lot more emphasis on the non-financial risks, right? The operational risk in particular. Certainly there are financial risks like budgetary issues and whatnot, but I think their emphasis is way more on the kind of like just the basic blocking and tackling of managing the business of an agency, if you will. But you're right, the fundamentals of managing risk in any organization are there. The only thing I would say at the end on some of this is, and you mentioned this, and I think this is something that every risk manager should heed, is I feel sometimes we're painted into a corner by too much, and I know this is going to sound bad, structure. That there is a framework, and we have to adhere to this rigid framework, and one size fits all. One size does not fit all. As you're finding in your organization, you are adapting to the culture, you're adapting to the organizational flow of what makes risk management work best there. And I think every institution, that's what you should strive for, is to find out, notwithstanding a regulatory requirement on things, but there are certainly ways to nuance that. And I keep coming back to what you said earlier. I want to get away from using strict risk, jargon in my conversations with other leaders, because I think that can be somewhat standoffish to them. They can say, oh, you're in this different world than what we operate in. And I'm not sure I'm buying into that. Does that seem to make
totally
sense?
Resonates. Yes. I completely agree. We, if we can get away from the jargon, if we can right size it for the organization. I mean, there's certain, like you said, fundamentals that need to be implemented to have a strong program, and then you tailor it for the needs of the organization and the culture and what are you solving for, right? It comes down to being really pragmatic about what, at the end of the day, what are you really trying to solve for, and then making sure that you right size it for that.
Right. And again, mindful of the time, I've got time for one more question that's come in here. It says, are there lessons from some of the big risk events from pharmaceuticals, from the financial services sector that can help pharma companies better manage their risk? And, I think we talked a little bit about that, but I don't know what your thoughts, Diane, on that might be.
Yeah, that's a great question, right? And because I think that when we were talking about the maturity of ERM in the pharma sector versus financial services, we can learn a lot from the lessons learned. We can even leapfrog maybe from, the failures that we've had of different things. But the one thing I would say is pay attention to culture. I have a feeling when we think about some of these scandals and bank scandals or any of these corporate scandals, it starts with culture and people. What are you rewarding? What behavior is being rewarded versus what you say you want the behavior to be, and making sure that there's levers to speak up and challenge that behavior. Because as we know, with some of these, when they're opening bank accounts that, are falsely being created and things like that, that goes against the values and the culture. And so how do you notice that and speak up and change that? I think those are the types of lessons. So thinking about culture and the environment and being courageous and having the ability to speak up to the right people.
I absolutely, I couldn't, I think that's a great way to sort of bring this home, because all roads lead back to culture. And I know that's, for folks that are kind of more on the quantitative side, that kind of feels a little a little queasy at times, but it's true. You can have the best risk infrastructure and the best people around you, but if I'm fond of saying, you can't always regulate bad behavior, right? As much as we had, look at it, Dodd-Frank, thousands of pages of legislation, tens of thousands of pages of regulation in the wake of the '08 crisis. And yet we still wind up with these recurring either big bank or, in the spring of last year, regional bank crises. And when you go back in, you'll find out that a lot of it can be pointed to poor culture, poor governance, poor oversight, poor operational process and controls. And no matter, you can have a corporate policy for this or that, regardless of what sector you're in. But you really need to, as we started off this discussion today, I think you're in a great situation by having a leadership team that not is just aware of risk management, but wants risk management. It's just something that I think is probably far and few between these days. I could be wrong about that, but it just simply says you're in a very proactive progressive minded organization from a risk standpoint, I think.
Yeah, I agree.
Great. Well, we're at the top of the hour, everybody. So again, thank you so much for coming. And I know we're going to have this recorded for everybody's viewing and listening later on. And Diane, thank you so much for joining us today, and hope to have you back in the not too distant future.
Yeah, thank you for having me. It's been great talking with you. Thank you.
Take care.